can help advance newborn screening interoperability nationwide. Just a note here that we'll be recording the presentation and making it available online, so if you miss anything, you'll be able to go back and check it out or share it with your colleagues. We're going to begin today with just an overview of the project and what we hope to achieve before we dive into what you can expect if you become part of our project. It'll describe our approaches to helping you prepare for interoperability, and we'll be going over the expectations and benefits of participating and how to apply. Finally, we're going to have some time to answer any questions you may have. Everyone should be on mute, but if you've got questions, please use the chat box to ask them. And another member of our team, Tia, will be monitoring those. Any questions that we don't get to along the way, we'll make sure that we tackle at the end of the presentation. Thanks for joining us and your interest in the project, and let's go ahead and get started. Before we start talking about the specifics of this particular project, we should probably say a little bit about what interoperability is, because it's at the core of what we hope to do. In their 10-year roadmap plan for advancing interoperability, the Office of the National Coordinator for Health IT, or ONC, defines interoperability as the ability of a system to exchange and use electronic health information with other systems without special effort on the part of the human user. It goes on to talk a little bit about sharing data in ways that are appropriate, secure, timely, and reliable, and to make sure that the right information is available at the right time for the right person. This is not only important for providers and for patients, but for public health as well, which is responsible not only for caring for the health of the general population, but also feeding research, providing clinical decision support for providers, and ensuring that individuals and their families get the services and support that they need. And often public health is doing this with very limited resources. It's important that our public health community is integrated into the expanding network of electronic data exchange so that we can make the most efficient use of our public health resources and serve those that we work with better. The goal of this project is ultimately to reduce the morbidity and mortality associated with heritable disorders in newborns and children, and doing this by enhancing the connectivity between state public health programs and healthcare providers. Our focus is going to be on helping you to prepare to receive and share data electronically in 3 key areas of newborn screening: dried blood spot screening orders and results, early hearing detection and intervention results, and pulse oximetry results. But we know that interoperability means so much more than just that. So we're going to be here to help you to achieve any of your newborn screening interoperability goals. And we aim to do all of this by establishing a newborn screening interoperability resource center that will enhance data interoperability by serving as a resource for health information data interoperability, and by providing some technical assistance and training and education in data interoperability to all of the state newborn programs that join our project. With support from HRSA's Maternal and Child Health Bureau, our project is going to develop 3 key deliverables. First, we'll be surveying the current national newborn screening interoperability landscape and consolidating that information into an environmental scan, documenting where we stand today. Then, using that document as a foundation, we'll be creating a user-friendly online resource center housing interoperability resources and training materials for newborn screening programs to access and to use as they prepare to implement their interoperability goals. And finally, we're going to be working hands-on with 20 different states and territories to complete an in-depth guided interoperability readiness assessment and to develop individualized roadmaps to help you achieve your goals. Our project team is made up of individuals from 4 great organizations. As the project lead, Altarum will be working over the next 3 years with Oz Systems, the American Academy of Pediatrics, and the Susan B. Meister Child Health Evaluation and Research Center at the University of Michigan to help advance interoperability. As well, we've put together a stellar advisory board to help us and help you be successful. representing all aspects of newborn screening and blending perspectives from the program, provider, family, and healthcare IT points of view. Our board is going to be an invaluable resource for the project. And as strong as that advisory board is, we have a project team to match. You'll be working with INBSI staff with extensive experience, not only in the nuts and bolts of technical infrastructure and interoperability, but also project management, education and outreach, workflow analysis, and more. Over the course of today's call, you'll be hearing from a number of my colleagues on the project. So let's take a minute to let them introduce themselves. Starting with my background, I've been in the business of interoperability for 15 years, first as an interface developer and implementer for a major EHR vendor, and then in the public health space. I've been deeply involved in standards development for a decade and have helped to develop a number of HL7 interoperability implementation guides in the areas of immunizations, laboratory orders and results, and newborn screening. I'm also a co-chair of HL7's Public Health Work Group and their version 2 management group. Now let's hear from Lisa.
Hello, everyone. My name is Lisa Steffi. I'm a project manager and the project manager for the INBSI project. I have served as a project manager on both state and federal contracts designed to improve healthcare quality and integrate health data through development of implementation standards and interoperability between healthcare organizations and qualified or state registries. I have been in the public health and interoperability space for about 11 years now, and prior to that, I worked as a research analyst on clinical trials. I actually was the former PM for Michigan's newborn screening pilot project to exchange CCHD results with Henry Ford Health System. And more recently, I've been working closely with Michigan's childhood lead poisoning prevention program to improve their data flow of blood lead test results into the state's environmental health databases. So I think that's a bit about me for now. So I'll pass it over to my colleague, Troy, to tell you a bit about himself.
Thank you, Lisa. Hello, everyone. My name is Troy Abrahams, and I'll be playing the role of team lead for the technical assistance group on this project. I've worked as an analyst for Altarum for about 4.5 years now, and my role during that time was to implement public health reporting use cases for a couple of states, newborn screening being an obvious example. Most recently, I've worked to implement new reporting options for Michigan's childhood lead poisoning prevention program, as well as assisting the state of Washington implement new COVID reporting measures for their communicable disease group. Prior to working with Altarum, I got my start in healthcare interoperability with a small startup lab here in Ann Arbor, Michigan. But my roots go all the way back to working in enterprise IT for a small consulting firm based out of the west side of Michigan. I think with that, I'll hand it over to Caitlin.
Hi, everyone. My name is Caitlin Houlihan, and I'm the team lead for the training and education portion of this project. My previous experience is working in the practice of public health informatics across the state health agency at the Minnesota Department of Health. I have worked with newborn screening, maternal and child health, environmental science, and most recently, infectious disease.
All right, thank you. So now you know a little bit more about the folks that you're going to hear about from today. Let's turn it over to Lisa so she can start to talk a little bit about what to expect out of this project.
Hopefully the introductions you all have just been given give you some insight into our team and what the INBSI program is about. So now I'd like to take a few minutes to explain in detail what you all can expect as a participant in our program. But before I dive into those expectations, I want to highlight that we understand there are a variety of drivers and workflows for each newborn screening program that make it very challenging to harmonize interoperability requirements. Our team and our project aims to address those needs in a variety of different ways, including reducing the burden of reporting for frontline healthcare providers, integrating data within state newborn screening programs to ensure that all public health personnel have timely, accurate, and complete data available, and ensuring that providers have access to the data necessary to provide the best possible care to affected children, harmonizing requirements for health IT vendors to speed development and deployment of software solutions, and last but not least, providing families with the consistent and accurate information and resources they need to navigate the challenges they face. On this slide, we've highlighted a few key items to help set expectations for you all as we chart our course towards meeting these goals. As a participant in our program, you will begin by assembling your team. We're looking for each state or territory partner team to consist of a diverse set of individuals representing the various functional and operational roles within your newborn screening program. So this could include informatics, operations, technical folks, epidemiology, and even business owners and leadership stakeholders. We also ask each team to have one main point of contact. So once your team is established, we will begin working alongside your team to assist you in completing what we're calling a readiness assessment and interoperability roadmap. Our technical assistance team will meet with each state to assess your interoperability readiness, knowledge of standards, and the desired connectivity or interoperability goals for your jurisdiction. We will also assess any knowledge gaps that are present and connect each state team with the appropriate educational materials needed. Our training and education team will develop the right level of educational resources specific to your state's needs. The goal of this readiness assessment phase is to understand the current interoperability environment of your jurisdiction and create a plan, again, what we're calling the interoperability roadmap, to get to your desired level of interoperability. We also aim to foster state-to-state newborn screening collaboration to build on each other's successes and lessons learned. As more states and territories join the program, we intend to have a mentorship program where states can begin to mentor the states and territories who are just beginning the program or just beginning their path towards interoperability. The goal of this is to build a collaborative community to foster open sharing of solutions to the more common barriers so we can advance interoperability across all newborn screening programs. Next slide. The newborn screening program approach begins with state engagement and onboarding to the program. We are aiming to recruit and work with 20 newborn screening program teams over the course of the next 3 years. Due to variability in each team's schedule and priorities, states will be onboarded in cohorts. We will work with the first cohort of states to gather information on their current interoperability landscape so we can complete their readiness assessment. From there, we will offer training for the most common interoperability issues to build upon the knowledge of the first cohort with the second cohort and so forth. The process then moves into building an interoperability roadmap and working with other newborn screening programs to build and learn from each other through our learning collaborative. There will be one application phase and applications are due February 12th. Announcements for the states selected to participate will be disseminated by March 1st. All states and territories are encouraged to apply now, and we ask that you indicate within your application what your team's availability is to begin actively working with us on your readiness assessment and interoperability roadmap. Beginning from each cohort of states and building from what we have learned from each cohort, we intend to foster that national collaboration between all the newborn screening programs in our program. And eventually that mentor-mentee program for states to continue in after the program ends in 2023. Next slide. As you see here, the newborn screening program has 3 core areas of support in our program participants. And in the next couple slides, we will take a deeper dive into how we will be approaching each of these areas of support. So now I'm going to hand the presentation over to my colleague, Troy Abrahams, to explain in detail what our technical assistance team will be offering our participating states and territories.
All right, thank you, Lisa. Let's see, the technical assistance team is here to provide support for states and to form newborn screening interoperability teams with the ultimate goal of developing state-specific implementation plans. Now, recruitment or enrollment is essentially what you hear today, so I'm going to move into our first real step, which is putting together a team. Now, one of the first things we'll want to do as a group is to coordinate the creation of interoperability planning teams within each state. The specifics of how we'll do that are covered a little more during the readiness assessments and roadmaps, but we'll work together to build a diverse and balanced team that accounts for the differing workflows across all the newborn screening use cases. Now, the first major item we're going to dive into together are the readiness assessments. Now, there are a few flavors of readiness assessments currently out there. Our project team wanted to approach these assessments in a way that promotes collaboration and would result in good data to help us build a plan for better interoperability. What we're currently planning for is more of a series of in-depth discovery sessions with your team to help truly capture the as-is of your newborn screening programs. In that series of discussions, we'll be covering topics such as IT infrastructure, workflow design, staff and resource capacity, and onboarding pilot readiness. In preparation, the project team here has been compiling a list of topics and questions and is organizing them into sort of templates to help provide a somewhat uniform experience for each state. I say somewhat because every jurisdiction is unique in how they approach interoperability, and part of the reason for doing these assessments is to acknowledge, work with, and of course plan for each state's current level of newborn screening interoperability. That being said, we're working to standardize our approach to help ensure that we have a full and detailed analysis of each state's current status. The ultimate goal, of course, for the readiness assessments are to understand the current interoperability landscape of your state in order to create a plan, the interoperability roadmap, to get you to that desired level of interoperability. Now, we've established that each state's readiness assessment will be the foundation for the creation of a tailored interoperability roadmap. To give you an idea, this plan will include things like project timelines, staff development and training plans, resource acquisition, infrastructure or software system upgrades or installs, or even data management plans. But to boil all of this down to something a little more easily digestible, we're essentially creating a sort of as-is and to-be document for all things related to newborn screening, related to newborn screening interop in your state. The timelines I mentioned will detail the steps necessary to go from the current as-is to the future to-be, but everything else gets compiled into a final deliverable, which is essentially just a planning document, a plan to help you get from where you are now to where you want to be. Now, I think it goes without saying that the TA team is here to support you and your team. Dare I say that the technical assistance team will be available for assistance. Our support will obviously be geared more towards planning and education in the realm of newborn screening and interop, but we want to be able to help any way we can. Our support offering goes hand in hand with the online resources that we'll be developing, but I'll save that for someone else a little later in the call. So in general, feel free to ask questions and we'll do our best to answer them directly. We also collaborate with some other organizations like New Steps and the CDC or even HL7. So if we don't know the answer, we can find, we can find out who does and get you pointed in the right direction. Now, to give an idea on what the timeline might look like here, I thought I'd give a quick example from the point of view of a participating state. A few weeks into the onboarding for this project, or say a few weeks after the registration closes, our team will start reaching out to each state to start the process of scheduling our readiness assessment workstations. Now, obviously, we won't be able to perform an assessment with every state all at once, so we'll be organizing the states into smaller cohorts, and from there the timelines can be staggered a little bit. Now, what I mean by that is if your team is included in the first cohort, then your process may kick off sometime in March. But if you're included in cohort 2, for example, your readiness assessment may not begin in earnest until a few months down the road. The readiness assessment work sessions for each state will most likely take place over the course of a couple months. Afterwards, the project team will take some time to put our heads together, compile notes, and just generally prepare before we dive into the next phase, which is building out those interoperability roadmaps. Now, the format of how these roadmaps will be developed is still sort of a work in progress, but in general, we'll want to see a similar level of participation from each state. We want to build this together so that your roadmap is as useful and actionable as possible. We want to make sure you have a good plan to achieve your newborn screening interoperability goals. And with that, I think I will hand it off to Caitlin to talk a little bit about training and education.
Thank you, Troy. Our team has identified strategy and communication, standards, interoperability, implementation, and evaluation and analysis as essential competencies among staff for success in an electronic data exchange project. Newborn screening programs must be able to strategize among competing projects and communicate goals to multiple stakeholders. We will provide training on the details of HL7 standards, IT infrastructure, project management, and implementation. We will discuss how to measure project success during and after project completion and demonstrate that you are meeting the quality measures and needs of your program. We will use a combination of existing training materials and create new materials to fill in gaps. Our approach is to provide tailored resources to you as the audience of professionals working in a newborn screening program. We understand each program's needs will be unique based on your previous experience. And within states, some of your team members may need a high-level knowledge, while others will want more in-depth training based on your position in the program. The materials will be distributed through an online learning management system where you can view materials at your own pace. We may suggest viewing materials within a specific time frame or certain sequential order, and you can expect 30 minutes to 2 hours of new training materials to be presented each month with additional opportunities to gain more knowledge. We will be intentional with the presentation and time commitment of our materials, breaking them down into micro-learning videos and quick guides where appropriate. We will also facilitate virtual collaboration opportunities. Sharing experiences and lessons learned among states and your colleagues is oftentimes the most impactful learning approach. Collaboration among programs will be tailored towards use case studies, consensus building, and mentorship. As the community expands and begins to share experiences and best practices, similarities and patterns will be identified, making the path to interoperability smoother for all programs. Lastly, our team is here for you and the learning needs within your program. We will take an iterative approach to training material development. Based on your feedback, we will improve materials, bring in additional subject matter experts, and identify areas for collaboration across newborn screening programs, providers, vendors, and organizations. Back to you, Lisa.
Thanks, Caitlin. Another core area of support we will offer newborn screening programs is the INBSI Resource Center website, which will have pragmatic solutions, including interactive and community-based forums, all of our training materials, as Caitlin just mentioned, and useful TA features. The goal is to provide a centralized location and place where not only we have resources presented, but policies and definitions, but also as a place to come and find real world answers and questions to problems facing newborn screening programs. The key components of the INBSI Online Resource Center include the targeted training materials within our LMS, the Learning Collaborative, as we've mentioned earlier, and the Technical Resource Library. Each state or territory participating in the program will have access to log into our Online Resource Center and access the LMS, and all of the tailored educational materials for your team will also be located within the LMS. As I mentioned, the website will serve as a centralized place for communication, and you'll be able to communicate with our INBSI team and other state newborn screening programs. The Learning Collaborative will be monitored by our program staff, and users will be able to tag content for easy searching and categorizing. Hot topics will be highlighted as solutions, and as answers are found, the broader community will be aware of the progress being made. Users will be able and expected to participate in our Learning Collaborative, so best practices can be shared and put into real life practice. As the Learning Collaborative expands and best practices are shared across states and territories, similarities and patterns will begin to emerge, paving the way for new states, making the path to interoperability faster and smoother. There will also be a technical resource area, which will serve as a location to house publicly available tools, code snippets, and other technical assets that may be valuable to your state newborn screening program. It will serve as a resource archive throughout the entire program's duration. As with many other programs, we intend on using continuous improvement as a method for evolving and advancing our online resource center. So as each cohort of states join the program, we intend on gathering feedback from them so we can grow with our user community and develop useful tools, features, and functionality to support them. We look forward to having you join our online resource center, so please keep an eye out for more information on when the INBSI Resource Center will be available. Now I'll hand the presentation back to Troy.
All right, thank you, Lisa. So we've talked a little bit about some of the project offerings and how we're tackling certain challenges, but we also wanted to take a moment to speak to what our expectations are for everybody else involved. Now, I think it goes without saying that everyone involved will benefit from more engagement and more communication. Now, we know that everyone here is busy, and the point here is not to add pressure, but this is one big collaborative effort, and without you, we won't get the outcome we're aiming for, which is a higher level of interoperability for newborn screening on a national scale. Now, for example, when we first meet to discuss putting together a team, be involved. Help us paint a picture of your current team and their roles. Let's work together to identify what skill sets we need involved, and let's build that team. The readiness assessments will essentially be a series of in-depth interviews, like I alluded to earlier, so involvement there may seem pretty straightforward. One thing we'll want to work together on is to identify what topics we'll be covering ahead of time so that we can have the right members of your team present during our sessions. So for example, if the topic of the day is going to be IT infrastructure, we may want to ensure that we have some colleagues of yours involved that understand the technical side of the interop landscape in your state. Now, excuse me. The education and training modules are being curated and designed to be shared for your benefit. Some of these may be interactive or require more active participation than others, and that's where we need you to be you. Be that passionate newborn screening coordinator, or be that knowledgeable data analyst and jump into these sessions head first. Not only is this a chance for some professional development, but it's also meant to be a collaborative experience, so help us all learn from each other. The online resource center that we're building is going to provide a space for all newborn screening programs to come together and share, to ask questions and do deep dives together. So obviously, we want you to participate in discussions and collaborations. When you have a question that you can't find the answer to, and of course it's related to newborn screening or interop, post it on the discussion board and let's talk about it. Or if you do notice a topic on the site that's not getting a lot of attention, add your thoughts and let's talk about it. These discussions are also an opportunity to network with members of other newborn screening teams across the country. This is our chance to get together and learn from one another. So long story short, our expectations for you on this project are that you're involved, so let's be involved. And with that, I will hand it back to Caitlin.
Newborn screening programs participating in this new program will receive the benefits of hands-on assistance from an experienced team of business analysts, project managers, informaticists, and subject matter experts in interoperability. Your staff will receive access to interoperability training materials, and your program will receive a documented interoperability roadmap, providing recommendations and solutions to achieving your data exchange goals. Attempts to harmonize requirements and strategy in other public health programs has yielded significant improvements in interoperability and has sped up success across states. This approach requires interprofessional collaboration, and we have brought together partners in public health, healthcare systems, and vendors to achieve this. Newborn screening programs are also able to receive up to $10,000 per year to help offset the cost of participation in this program. Next slide.
Now that you've heard about what the program is, our expectations of the participating states or territories, and how our program can benefit your jurisdiction, I'd like to take a look at the overall timelines for the program. So the INBSI program runs from the fall of 2020 through the fall of 2023. We have already begun the program initiation phase, as well as state recruitment and engagement of our first cohort of states. So the application deadline, just as a reminder, is February 12th, and notifications of acceptance into the program will be announced no later than March 1st. Each state or territory's availability will inform their cohort assignment, and we will be onboarding groups throughout 2021 and 2022. Active engagement with our TA team to work through that readiness assessment and the creation of your interoperability roadmap will begin shortly after your team is onboarded. And there will be some overlap in those activities. As Troy mentioned, there will be work sessions and whatnot. So in general, we anticipate the readiness assessment and interoperability roadmap development phase to take about 6 or 7 months, give or take. We understand that this is going to be dependent on your program team's availability and bandwidth, and we also understand that there will be other priorities for your teams. And therefore, please note these dates are intended to provide a general guideline of when these activities shall occur for each of the cohorts. They are not meant to be definitive. Once your state or territory is accepted into the program, our TA team will reach out to you and work directly with you and your team to set reasonably agreed upon timelines for any activities and deliverables or work sessions. I will now hand the presentation back to our project director, Craig, to discuss how you can apply for the program.
All right, thanks. Hopefully you've got a pretty good idea now of what we envision for this program and where you might fit into it. We know that we've got a great newborn screening community that we're trying to work with, full of good, knowledgeable people. And really, we're trying to help enhance the collaboration and the networking and the shared solution finding within the community. We hope that's going to be a fun process as well. Like I say, there's a lot of good people in here, and we hope that we can bring people together so that they not only make progress in their interoperability, but get to know people better, know who to go to when they've got questions. So hopefully you'll be excited to join our community. What we're looking for are partner programs with the willingness to come together as a broad team to advance newborn screening interoperability. And we'd like to encourage all states, territories, and districts to submit an application to join us. We do know there's a lot going on now, right? And so our aim is to keep the application process fairly lightweight and to a minimum. But we do need to know a little bit more about your team, the current state of your interoperability, your goals, and your priorities. As part of the application, we're going to ask you to tell us a little bit about where you are today and where you'd like to get to tomorrow. We know not every program is at the same place, and we aim to work with programs across the spectrum of interoperability readiness. Whether you're just starting that journey or you've made substantial headway, we think that we can help. You've heard, we'd also like to hear a little bit about the group of people that will be involved. You've gotten the idea so far, I think, that we're going to need to involve a wide range of people on your project teams, from operations and process people through the technical infrastructure folks. And so we want to hear a little bit about who you think will be involved on your side. We don't need all the names, and it's not a binding commitment, but we do need to get a little bit of a feel for who we're going to be working with. And keep in mind, the goal is to create a uniform roadmap for newborn screening within your state or territory. And so we are hoping to get broad input from the major newborn screening programs and bring them all together with this project. We're also looking to learn a little bit about your plan to implement the roadmap that we're going to be developing together. Again, we don't need a whole lot of detail, but we'd like to hear a bit about how you expect to put the plans we create into action. A plan is really only as good as the plan to implement it. And then finally, we're asking for one or more letters of support showing support for newborn screening interoperability. This can be from program management, IT leadership, or any other stakeholders that have an interest in seeing advances in newborn screening interoperability. And as we've said, this is a 3-year program, and we'll be starting to work with new groups of states and territorial programs throughout the life of this project, starting with the first group this spring. So even if you're not able to engage with our program right now, we still want to hear from you and when you might be able to work with us. After discussing this opportunity with your colleagues back at your state, please do visit our survey link in the slides or in the program description you received to register your interest. Whether you're ready to go right now or maybe interested in joining the program later this year or even sometime beyond, please fill in that survey so that we can gauge the interest in the project. Finally, we are asking that you return the full application to us by February 12th. We're hoping it won't be that much work, and we'll be reviewing the applications and, as we've said, contacting states shortly after that towards the end of the month. And so that we can get a good start come this spring. But if for some reason other priorities make it difficult to meet that February 12th date, please do reach out to us. Let us know so that we can work with you to accommodate your schedule. So if you have any questions about the application process, please don't hesitate to reach out and ask. We're here to answer any questions you might have. And that really concludes the presentation that we have so far, and so we'd like to open it up for questions. As we said before, please use the chat box if you have any questions, or if after the fact things come to mind, we do have an email address, nbsinterop@altarum.org, where you can reach out and ask any questions you have. And don't forget to register your jurisdiction's interest with that survey. And again, do talk to your colleagues first. We want to make sure that we're getting a single response from any particular state or territory or district. So Let's turn it over to questions. And so I will ask my colleague Tia, who's been monitoring the chat box. Do we have any questions so far?
Yeah, we have a couple. So first question says, could we please receive a PDF of the interest survey so we can prepare our answers ahead of time with our partners?
We can get that out to people. Yes, it's no problem.
All right. And the next question says, can states decline the funding and only receive the TA and assistance?
I see no reason why not. We do want to work with states, and so if that is what works best with you, we would still count you as, one of the 20 states we're working with, but I don't see that as a problem. Of course, we'll have to work out the fine details, as we are working on onboarding with you, but at this point, I don't see that being a deal breaker.
And we have another one that says, is the maximum grant award $10,000?
It is $10,000 per year. One of the things that we're hoping is that even after states complete their interoperability readiness assessment and roadmap, that you'll stay on with the project and still be an active collaborator in our learning collaborative space, where you can maybe ask your questions or help other people get their questions answered, continue to do education. So it is a maximum of $10,000 per year, provided that you're maintaining a level of active engagement. And really all that means is that you're working with us and staying active in the project, as Troy went over.
So just to let you guys know too, the online interest form is in the chat. So there is a link for you to click on that. And then we have a couple more questions. One says, can you please point us to the application? Is it online somewhere?
Sure. We did reach out to folks within the newborn screening community via email. The application was included there. We will be posting this video, and we will try and load the application materials there as well. But in the meantime, if you want to just give us a quick email at nbsinterop, we can make sure we send those out to you sooner rather than later.
Yep. And then Faza, yes, there will be a recording of the webinar. We will send that out after this presentation. Another question is there a way we can get a copy of this presentation?
Certainly. We will try and post that too with the video. But again, in the meantime, if you want it a little sooner rather than later, just hit us up at nbsinterop. Just while we're waiting for other questions, while people are thinking of them, you may be wondering what happens if you're not one of the 20 states that we're working with hands-on. And the answer is we still want to help you meet your goals. And so any of the educational material that we create as part of this project will be generally available. You don't have to be officially onboarded with the project to access that. The benefit to onboarding really is sort of the customized educational curricula, but we do plan to make all of our educational and training materials widely available to the community. So everyone should have access to that, as well as opportunities to collaborate and network and create linkages between programs. So we're hoping that even if you're not part of the 20 we're working hands-on with, you'll still be engaged with the project and hopefully benefit from the work that we and our state program partners do.
Well, Craig, we have another question. It says, can the program assist a newborn screening program in working with a local health information exchange?
Yeah, I think that will all be part of the readiness assessment. We want to know what other organizations such as HIEs are part of your state, that are part of your interoperability landscape. And so we'll be digging into that as part of a readiness assessment. And if working with those HIEs or other partners is what you need to do in order to accomplish the goals, we'll make sure that gets reflected in the roadmap. So pretty much anything about interoperability and newborn screening is certainly fair game to work on as part of this project.
And for those of you wondering what the email address to reach us is, it's in the chat. And that's NBS, and is in Nancy, interop at altarum.org. And there's a comment in here. It says, thank you for this opportunity. Just this week, our chapter had a call from one of our members regarding a difference between the official public health laboratory dried blood spot screening and the unofficial public health system. And we are having to go back and retrain our members on securing results.
Right, I think that's a good point, and we are looking for all sorts of feedback. So as we develop our educational program or work with you in readiness assessments, if there's areas that you think need additional attention or where you have questions, do reach out to us. You know, we're always happy to hear what your needs are. That's going to be a big part of what we do, is finding out from you what you need from us, and then helping produce the educational materials and such that fill those needs. So if there are places within the interoperability world that you see gaps in existing resources, or you just have questions, right, that's what our program is going to be here for.
Craig, we have another question. It says, can we participate if our DBS, dry blood spot screening, hearing and screening, and CCHD screening are separate programs? Our program only handles DBS.
Yeah, so our goal is for any particular state or territory to work with as many of the newborn screening programs as possible. We understand that different states are organized differently. Some of those programs are allied together. Sometimes they're very siloed. And part of what we want to do is help you break down any silos that exist within newborn screening programs. So we certainly want to encourage you to work as a jurisdiction and bring everyone that you can to the table, right? But if for some reason programs aren't able to participate, it doesn't disqualify you, right? We're encouraging everyone to bring as many people to the table as you can. One thing that we have seen within the interoperability world is anything we can do to harmonize requirements, to keep things similar between different programs, really smooths interoperability. So if we can have similar expectations and requirements for dried blood spot orders and results as we do for early hearing detection results, it tends to make things easier with the partner healthcare organizations you're trying to onboard and start exchanging data with. So that's one of the reasons why we're really looking to have all three programs involved, and really extend it so that you know how to reach out to other programs within your jurisdiction, be it immunization or electronic case reporting, maybe programs that have a little more experience with electronic interoperability and HL7 standards, and really leverage what they're doing and harmonize with them as much as possible, right? There's always local variation and program variation, but anything we can do to bring those sorts of people together is really, you know, part of our goal and part of our mission. And I realize that was a really long answer for having, you know, been able to probably just say, no, it doesn't disqualify you, so.
Any other questions? I don't see any in the chat.
All right. Well, if there are no other questions, we'll let folks get out of here just a few minutes early. Just sort of the take-home messages. Please do go back, talk to your colleagues, do fill out the survey to register your interest, and then do work towards that February 12th application deadline. And again, if you've got any questions, if you have concerns with any of those deadlines, do reach out to us. We're happy to work with you. Again, right, we've said it before and you all know it, right? There's a lot going on these days, and so we want to be flexible and help you meet you where you are. So do reach out to us with any questions, and unless there's anything that's coming through in the chat in the last 30 seconds or so, we'll let everyone enjoy the rest of their afternoon.
We do have one comment. It says the other general comments. Oh, that one, sorry. The other general comments are different entities input dry blood spot screening, CCHD, and newborn hearing screening results. There used to be an integration between medical record and public health early identification. Our health networks are not often utilized. A hospitalist is listed as the ordering physician, which is unlikely to be the child's medical home.
Right, so that sounds like there may be larger integration issues with sharing data within, in between organizations. And so again, if there are interoperability issues that you're facing now in terms of not just accessing data, but collating it, deduplicating patients, that sort of thing, we want to make sure that we can work with you to help plan out solutions for those and understand what the complications are. So if there are issues, that we haven't really talked about, we're fairly high level at this point. The standards that exist for newborn screening are typically written to very specific use cases. But if there are other use cases that would benefit from discussion as part of this project, do bring them up with us, and we can do our best to help you work through any other more specific problems you might have. All right, well, thank you for joining us this afternoon. We hope you are as excited about this project as we are. And again, if you've got any questions after this presentation, do reach out to us. But otherwise, we look forward to participating with you in the future. Have a great afternoon. Thanks for joining us.